Welcome to the second session of the Social Justice Speaker Series. I have a little bit of housekeeping for our Touro students, and so community members, please bear with me. I did send out an email. I'm Professor Wilson, so you've been receiving email from me with regard to the Social Justice Speaker Series. If you have not been receiving announcements, then you need to set your notifications on Canvas to receive announcement notifications. That is a personal preference that you can set or not set, but you would probably want to receive notifications more than weekly. And so if you have not already done so, please change your settings. If you choose not to, it's your responsibility to regularly check each of the course websites. There was an assignment due today that was sent out last week, and so I noticed that a good number of you had not completed the assignment. So please do so by tomorrow. I've given you all an extension as a courtesy until tomorrow at 11:59 p.m. Pacific time. If you have any questions about the course, just send me an email. All right. So I'd like to welcome our speakers. We have two wonderful speakers who are going to talk about the impacts of immigration on, can you hear me? No? You can't hear me in the back? Wait a minute. Do I have to lean forward? Yeah. Okay. Let's try something. That was such a wonderful speech. As we stand. Okay, so we have two great speakers who are going to cover the mental health impacts of immigration. There are going to be, of course, some data, but also we have a wonderful speaker from Highland Hospital who's going to provide more of her personal encounters along with some data with regard to the mental health impacts and trauma that patients in her clinic experience during the course of immigration. So with that, I'd like to introduce Laura Lopez. She immigrated to the United States from Peru at the age of 18 and has experienced challenges and discrimination faced by low wages and immigrant workers. She received the Community Justice Award presented by Centro Legal de la Raza, the Barbara Lee Special Congressional Recognition Award for community justice, and was chosen as one of the top community health leaders in the country by the Robert Wood Johnson Foundation. Laura currently works at Highland Hospital as a family specialist, and she's going to provide great feedback and information with regard to the experiences of trauma and the resulting mental health impacts of immigrants here in the United States. Thank you.
Buenas tardes. Good afternoon, everyone. Good afternoon. You guys feel good? Yeah. All right. Good. Okay, so like I said, my name is Laura. So I'm really happy to be here. Thank you for the invitation. It's an honor to be here and talking to all of you guys. So I did have a PowerPoint, but before we start a PowerPoint, I want to show you a small video. Bear with me because I'm not good at this. Here. Yes, I got it. I want you to see this video first.
We need to be ready for whatever may come our way. My name is Scott Strippel, and I'm a meteorologist at BGE. We make sure that our crews
Sorry, a little bit of
so every single day we want
this commercial, like everywhere. Like, I know that when you get ready to have commercials, so we have commercials when you do all that talking.
Get ready, learn how you can be prepared at bge.com/be prepared.
It's only 1 minute, 30 seconds that you're going to do.
The train you're looking at is a freight train, but it's also known as the Beast, or also the train of death. Right now it's getting hooked up with other cars. It starts journeying on. You can hear the noise. In essence, it's a freight train. But what happens when it starts its journey, which is actually start about 2 hours, It becomes a train for undocumented migrants to ride on top of, to ride in between the cars, just not to ride inside. And every day, hundreds of migrants are on these trains, incredibly dangerous, and they call it the train of death because so many people do die and get hurt. When the train stops, people who are on top climb down, and they get off in between the cars. And many times, a wheel will roll over the foot, or an arm, or somebody's body. Happens all the time, and it's been happening for many years. This particular town that we're in right now is about 250 miles north of the Guatemala-Mexican border, about 750 miles north of the closest point of the United States in the Rio Grande Valley, Texas. And what immigrants do is they start in the southern portion of Mexico. They end up switching trains a few times. It takes a minimum, if everything works out well, weeks to get to where they have to go, but it often takes longer, and sometimes they don't succeed at all because they get sick, they get killed. Many people have ridden the train many times, only to they walk back here, if they continue trying to get to the United States. There's a shelter in this town, a very well-known shelter, where volunteers from places including the United States tend to these migrants who get off the train for a break, who want food, who want water, who want medical care. They stay in the shelter, and then they come back, they get on the beach, hoping for a successful ride to the United States, but often, in many cases, failing very miserably. They try to.
Okay. All right. I think so we start a little intense, correct? So the video that we saw is like how many people also come to this country to immigrate. So when I was coming here, I was having so many different things I want to say and share with all of you guys. I want to talk about stories, I want to tell you so many things, but it's hard. We have only 15 minutes. So we're going to go through it very quickly. So why I'm saying also why I do it myself because I can, as I'm a documenting person to this country. How many of you guys know somebody who been undocumented? Raise your hands. How many of you guys know somebody who been deported? So how many of you guys know the person who got deported died? So why we come here, or why everybody come here? To escape trauma, all right? Because a lot of things happening everywhere. This is very special for you. Escape violence, the war, games, to escape poverty, healthcare. I don't know if you hear the news right now, but there are people from Honduras, over 5,000 people are crossing the border. That in Guatemala, they just opened the border right now in Mexico. It was a father with 2 kids in a stroller walking from Honduras. Why? Because they know 2 kids are sick. And that's why they decided to take that road to come to the United States. And that's why medical care. Where are we coming from? Everywhere. Everywhere. We speak many different languages. We have different colors, shapes, everywhere. And everybody come for a better life. How many of you guys have a family member who immigrated from another country? When we talk about mental health, also it's different types of trauma. And one here say documented immigrants. Documented immigrant. I am documented immigrant. I have my paper now. I didn't have a paperwork for a long time. But still, every time I go to immigration to cross the border, my heart changes, get nervous, my hands sweat. Because still immigration has stopped me and asked me for my papers. And I still show my USB passport and they still ask me for more information. Yes, I have paper, but I still have that trauma. I'm documenting immigrants. A lot of stress. Can you imagine leaving your home, leave the kids at school and thinking that you're gonna be back home that day, if you're gonna be able to see your kids, or having the little children. I had this patient, she was 10 years old, and her mom told me that her teacher was asking her to translate to the class about what is being undocumented. She was crying. She was scared her parents not gonna go back home. That's stress. U.S.-born children of undocumented immigrants. I see that too. I had a mom who her baby is 2 months, but the other children is 10 years old. 15 years old. Mom and dad are undocumented, they're from Mexico. And it's a little bit hard to do paperwork for people who come from Mexico. It's more difficult for them. And they've been there a long time, more than 15 years, I think. And I see the daughter, when they come to the visit, bring the little baby and saying how she feels about it, if the parents are not going to be there. If they get deported, who's going to take care of that baby? So they have that stress too. DACA. Do you guys hear about DACA? That's another big group of young people who came without knowing they're being undocumented, and when they go to school, they want to get some job, but no paper. And now we don't know what's going to happen with this immigration. So they create also stress and trauma. Before I move on, I want to tell you a story about this family. Last week, I met this mom. She crossed the border 3 months ago on July 12th, I think is what she said today. The 17 years old, 18 years old, and 7 years old. When I went to the room, they came and said, I need the vaccine for my little kid and my daughter so they can go to school. It's like, okay, we can make the appointment, we can help you, no problem. The doctors did what they have to do, they went the questionnaire, everything. Then I said, I'm gonna go say hi to the family. And the lady said, gracias por ayudarme. It's like, de nada, señora, no, you're welcome, nothing, we're here to help you, to support you. And I don't know what happened in that moment. The mom said, my daughter and I, we've been raped. Imagine the little boy who was 7 years old sitting in the table, the exam. Mom was sitting here. Her daughter, 70 years next to her, with a face that looked she's 14. I didn't know what to say. I kneeled and I held her hands. And at the same time, I looked at the little boy. And I was, what am I gonna do in my head? I should ask more? No. I should have to stop. I didn't want the little boy, 7 years old, remember the trauma because he didn't see what happened. What I did that moment, the only thing I couldn't is tell mom and everybody who was there, you're here now, and we are here for you. And we're gonna figure out a way to help you. I let her cry, then the MA came to do the vaccines for the little boy. Because I don't have time, I want to tell you what happened today. Today, the 17 years old came to have an exam. I talked to the doctor before that about what happened with the family a little bit. And we had a little plan in my head what we're supposed to do and how we're supposed to help this family. When I got to the room, we started talking about immigration, about the paper, what you need, about medical, how to get food so they can eat, you know, like what the papers they're gonna need for the school. And then she said, I got a text from my lawyer. My lawyer gave me 4 places that need to get an evaluation, a mental health evaluation. And that was for trauma. And that's how I started telling the story. Mom was sitting in the chair next with a 17 years old who looked 14, petite, skinny, big eyes. Mom with her jeans holding tight started talking to me and telling me what happened. Did you guys hear about Salvatrucha? Do you know what is Salvatrucha? No? It's a gang. The most dangerous gang can be in El Salvador. The 18 years old want to be, the Salvatrucha want to recruit this 18 years old. He didn't want to be recruited. He was going to church and go to school. Mom was working in a pupuseria, and she had to pay every I don't know, every month or every week, probably every month, $10 to the Salvatrucha, so that people don't come and do something to their family. But one day, this gang told them, this is your last time. Are you going to join us or no? And he said no. And what happened? I said, okay, we're going to give you a surprise. The 17-year-old was telling me that. She said, we didn't know what the surprise was. So that night, they came to their house. They raped her, they raped the mom, and they raped also the auntie who was living there. The 7 years old, they threw him in the room, locking him. The 18 years old got beat up. The uncle got beat up. And they said, tomorrow we back to kill you. What do you do when you hear these people coming to your home and threatening you and doing what you do? You're gonna use the train to come here. You're gonna walk where you have to walk. You're gonna leave everything behind because you're looking for a better life. This story hurt me a lot. It's not only because it's not the first time they hear this. What hurt me more is when I see this 17-year-old looking at my eyes, me dijo, she said, yo no quiero regresar. I don't want to go back. I don't want to go back. That breaks my heart. I'm sorry to give you this story, but this is the reality outside the story. It may be the reality for many people who we know, but they don't say. Now, was a lot. Sorry. How you guys feeling about it? For mental health, the reality for mental health is not many resources. It's not enough mental health, Spanish speaking, or different other language. Right now it's a waiting time. It's not enough resources that we can have, unfortunately. The waiting time for kids is around 3 to 4 weeks. I mean, this is if we apply in many places. In English, we do have it. But for Spanish speaking other language, it's been a little bit more difficult to get people in. So that's why, when you think about as an immigrant, it's not only what the struggle and the problems they have in coming here. It's also what they bring from home, the trauma. When they come here, and sometimes they don't have a job, they don't have food to eat, they don't have a place to live, that creates more stress. But the one thing that many immigrants don't lose sometimes, I say sometimes because sometimes I include myself, I lose, is hope. The hope that something will be better. And that's what happened with this family. Today, before they left, she said to me, the mom and the daughter, thank you, because we still have faith that we're going to find good people every time that we talk somebody, we've been finding good people. And she said, I have a faith that we're going to be fine, that one day I'm going to be able to have a permit to work. So when I bring you this story, is to you guys to reflect. Who are the people? What is being an immigrant and what is mental health? But it is not necessarily mental health being immigrant. And everybody, we need our own mental health. Because like you guys, when they hear this trauma, is passing to you. And you're gonna carry that too. So everyone needs to think about it. Think about it, the people who you know who are undocumented, the people that you don't know, then don't, when you think about them, think about it how you can, give it a good, nice word. Say good morning, say how are you. Doesn't matter doesn't speak your language. For me, it was very important. When I didn't speak English, I was depressed. Somebody came and speaking a different language and smiled to me. That helped me that day. And that helped many people. My heart is shaking right now because this is a story of no one person. It's a story of many people. I want to cry, yet at the same time I want to smile. When you are an immigrant, like myself, and you're working in the community, sometimes with every person that you touch, sometimes you remind how your own personal life. And that's why I feel I love what I do, to help people, to empower people, to let my community to know that it's okay to ask for help, that we have the right to be here. And that's what I ask you guys, when you meet somebody who feels low, let them know that you have the right to be here, that you have the power, and we are here for you. And I'm not going to hold you, but we want to walk together. Tell them. That's the words of courage. That's the words I hear for me to move forward and do the work I need to do. Thank you.
Right now, we'd like to open it up for questions and answers, so we have about 10 minutes between speakers for Q&A, because I don't want too much time to go between our first speaker and our second, because I think this was quite an emotional portrayal of real life of immigrants that come to this country. So if you have any questions, why don't you raise your hand and we will repeat the question so that we can get it on camera.
As we come in contact as providers with patient stress stories similar to the one that you shared, how can we most effectively steer them to resources like when you provide a Highland? I know a lot of times there can be some inherent mistrust or anxiety when you're undocumented to look for professional advice or help. So what tools or resources would you advise us to share as we deal with this?
Yeah.
So, I'm just going to repeat the question. So you're asking what kind of resources are available as a clinician?
Correct, or just an approach
And what
to
approach?
kind of, maybe instill some trust and faith in people who might be afraid to interact with the system when they're undocumented.
So, at Highland, we do have like a social workers. Sometimes that really help a lot. And also we have the health advocates. But personally, what I do with my families is when I meet them, I try to hear the stories and find out what is the most needed in that moment. With this mom, in my mind was immigration, food, maybe housing. I already had like connections with a legal support. I was already talking to the food bank because unfortunately they don't qualify for cotton fresh because they don't have papers, so I need to figure out some type of food. But mom, what came here to Highland was for the kids going to school. So my focus now is work with the Unified School in Oakland. Now and I know it's an organization who provides services for new kids, immigrants, and they provide social worker, mental health, and even immigration. So the more the resources, the more connections that you have around the area where you work, the better. Established relationship is the main thing. Like that's what I do. Go to different agencies to talk about the services that they provide. And the most important thing is like build a relation and know a name of the person. Because sometimes you say, oh yeah, this is the phone number, but you don't know. I always check. I call, okay, this is what they told me, your website is true. Well, actually, no, okay. So that's more research, a lot of research.
What is the name of the program that you said in Oakland for the children?
They have newcomers. I can give you the link, the website. Yeah.
They have in Contra Costa?
I have it here in Contra Costa. It's a big funding came to Oakland because a lot of kids was coming to Oakland new entry, but I don't know. I can give you information. I can give you the phone number of the manager. I can have a meeting tomorrow. Any other questions? We're good?
Our next speaker is Renee Bacchues. She is the program manager for the Health Equity Investments at the Bay Area Regional Health and Equities Initiative, Bar High. She brings over 8 years of health and human service experience advocating for systems change. She received her MPH from the University of Illinois at Chicago School of Public Health in Community Health Science. And she's going to present the results of a mental health survey that was done by Bar High that surveyed, I'm not sure how many immigrants, and it surveys their actual mental health status. Renee.
Thank you so much for inviting me and for inviting me here today. It's honestly an honor and a privilege. I would like to just say thank you so much to Laura for sharing her story, and that takes a certain amount of courage and power to do that. So can we please give Laura another round of applause? So I hope to share our work from Bar High with you today, and how it relates to immigrant and mental health, and discuss some solutions to policy and systems change, but also deliver some resources for on-the-ground providers such as yourself. I'm from Bar High. We are the coalition of the local health departments in the Bay Area. It is our mission to transform public health practice and to reduce systemic structural inequities that persist over time. Here are our Bar High founders about 15 years ago or so. These 4 folks got together. They're the directors of the public health divisions from San Francisco, Alameda, Contra Costa, and said that we need to work on issues of health inequities that cross our jurisdictional lines, right? Like issues such as life expectancy gaps and infant mortality gaps. Those are the kinds of things that are continuing to persist, although we know the solutions and we know how to move those things forward. So I'd like to start with this definition, or offer this definition of health inequities before any of the presentations. Can I have a volunteer read what's up here on the top? Someone who has a very loud voice.
Sure.
Please, thank you.
Health inequities are differences in health status and mortality rates across population groups that are systemic, avoidable, unfair, and unjust.
Thank you. These are the differences in life expectancy that are not small, right? These are differences of 10 years up to 17 years. So in Oakland, for example, between the flats and the hills, which is about a mile apart, there's a 10-year difference of life expectancy for people of color living in those neighborhoods versus the white population living in different neighborhoods, right? And in Marin County, we see these differences up to 17 years. So that's the difference of knowing your grandchildren or not. It's not a small measure. I'm curious, has anyone seen this Bar High framework before today? Few? Sorry, okay. So this is the Bar High framework that we operate within, and has been replicated with the Office of California Health Equity and written into textbooks. Where we start to see public health, and as you may have in your own practice, is this kind of downstream look at public health. So looking at risk behaviors, disease injury, chronic disease prevention. A lot of us within clinical fields are working in this space, and this is vitally important, right? We can't be healthy without health care, for example, and without looking at these other behaviors. But what we do at Bar High is we work, on the upstream factors. We want to be moving towards these inequities of care. So In the living conditions, for example, that's some of our housing work. And there's a housing crisis in the Bay Area, right? I'll be going into a little bit of some of the movement that we've made in that and some of the policy solutions we're pushing forward. So the institutional inequities are the differences between corporations and businesses and nonprofit institutions, right? And the social inequities are those we know between race and class and gender and immigration status. And these inequities are so persistent and so structural that we can see that by someone's race, class, gender, immigration status predicts life expectancy and downstream, right? So this is why it's so important for us to be thinking about policy and systems change. Curious, has anyone seen this picture before? This is the moment we're experiencing in the Bay Area. We like to use the analogy of a frog in boiling water. If you drop a frog in boiling water, it'll jump out. It knows it's hot and it'll immediately jump out. If you drop a frog in regular temperature water, it won't jump out. It'll say, okay, this is cool, I'll stay here for a minute. And then you can slowly increase the temperature bit by bit, or degree by degree, rather, and slowly it will meet its fate. This is how we're experiencing the housing crisis in the Bay Area. Our low and middle income communities are being displaced. Our cultural centers, our social units are being displaced, right? So that slow increase of heat is the displacement of our communities being accepted. So these are the three stressors that we're going to talk about as it relates to immigration and mental health. Those being housing affordability, immigration policy change on the federal level, and climate change. Climate change is how it relates to our disaster recovery work. And so we know that the solutions are needed at scale. We are again, a collection of Bay Area public health departments, which is regional. So we have not just a local scope, but a regional one. And we'll leave with what you can do in the meantime, right? So in order to do any of this type of change, we know it takes strategic partnerships, it takes advocacy, it takes work. It's a hard thing to do, and it happens over time, right? So we'll leave you with some personal and professional actions that you can take in the meantime. So first is our housing affordability and health findings. We conducted a study on housing stability and family health. This was informed by maternal child health directors and their frontline staff. So those who were going out into the community doing home visits, those MCH programs, started to see how it was impacting families and how the housing affordability was impacting families. So they started to see how people were doubling up in their houses, which could be fine in some cases, of course, but this is not ideal for and healthy for all families, right? So we have two briefs, and I brought some today. I have a couple copies. I'm happy to send them along electronically too. But the findings from our two issue briefs on the impacts of housing affordability and health and the impact on families are that people can work hard. They can work 2 to 3 jobs, but still not afford housing in the Bay Area, right? And this directly affects their health. Families are faced with unhealthy trade-offs, such as having to, if they're paying more on rent, they're not able to pay as much on food, on health care, on child care. We talked, there's also the mental health impacts, the emotional toll, the mental distress from unstable housing, as well as long commutes, air quality and congestion that can rise. Eviction, homelessness, and unsafe housing conditions are some of the other research that we uncovered from these two briefs. So this main takeaway of this information is about half of the Bay Area is undergoing displacement right now. And those who are rent burdened weighs heaviest on our low-income communities, right? So those who less than earning earning less than $35,000 a year are up to 90% rent burden. If we're looking at a snapshot of housing affordability within currently of low-income households that can comfortably afford their housing, they're able to spend a third more on healthy foods and 5 times as much on health care. If we're looking at how this impacts the families, families are twice as likely to be in poor health if they're unable to afford their housing. And we see this impacts are largest for families of color. Latinx families are 3 times more likely, and African American families are nearly 5 times more likely to pay half of their income on housing. So, as again, we're seeing a trend within the region of our families, our communities being displaced into the outer counties. And this wave of displacement has pushed scores of our middle and working class families to the outer areas where there's limited public resources and services and jobs. So there are 3 developmental windows that we see to help promote healthy housing policies in pregnancy, early childhood, and generational impacts. And what our maternal child health directors helped us articulate was babies are not blank slates. We do not enter this world equally, right? And if we're thinking about immigration and refugees and asylees and how they're coming to the U.S. and the journeys that they're facing, if you're thinking about your own clients, for example, we know that there are moments and toxic stress happening within that, right? And we know that this amount of stress is passed from baby to, from mother to baby in utero. We see regionally that the African American infant mortality rate is more than 4 times that of the white infant mortality rate. So here are some of the mental health adverse childhood experiences, information from our families brief, and I'm curious, I know this is very current in the literature, if you've heard of ACEs before, Adverse Childhood Experiences Study. Cool. Well, not cool, but great that you've seen the research. Because you know that the higher ACE scores, it leads to poor health later in life, right? So again, we're thinking about, and it's really hard, I think, for policy folks, systems folks, to think about the micro level interactions that people face day to day, right? The amount of racism, the amount of discrimination, the amount of barriers that people face is quite daunting. And we see here that as we try to push for policies, that it's important to continue to tell stories and continue to collaborate and partner to provide solutions. So I'd love to transition us on to some solutions that we've found at Bar High. This was in collaboration or coordination with CASA, which is the Committee to House the Bay Area. This group came together to name game-changing solutions to solve the housing affordability crisis in the Bay Area. These folks were developers, philanthropy, folks, labor, elected officials, right? And they named their 3 policy solutions, that being the protection, preservation, and production of affordable housing, the 3 Ps. Regionally, we know there are about 450,000 low-income renters households at risk for displacement right now, and protecting those units, those families, are most important for public health. Right? Because we know that these families are facing eviction and they do not have decades to wait. So committing to strong tenant protections, for example, is critical to stem the tide of displaced communities. preserve affordable housing and to take units off of the speculative market, and preserve the deed restricted units being, thank you. So improving housing quality and the conditions of housing. And lastly, reduction is to meet the needs of affordable housing for our low and middle income communities. Because the market tends to not necessarily meet needs or at all times. So if you total all this up, this adds up to about $1.6 to $2 billion a year, which may seem like a lot, but it corresponds to Measure M, which was passed in LA recently. And it's more expensive to not have a solution and continue to lose our people and our communities and increasing the level of impact to our climate as well. So this is a record response survey from our federal immigration policy and health impacts. We'll be returning, I think, next month with Marlene Acosta, who is the key epidemiologist leading the study, and we'll go further into these findings. So right now, I'm just giving an overview of some of what we found and how it relates to immigration and mental health. So the response we kept hearing from our members and their clients, that being local health departments, was that fear was changing people's habits. Fear was causing people to disregard services, and it was causing people extreme amount of stress and disengagement. Okay. I'm curious if I could take a pause for a moment. Here are some of the things that we found within our research. My question is, how can fear lead to other unhealthy behavior change in this current federal climate? We see that people are afraid to sign up for public programs. They have increased mental health impacts. They're afraid of going into detention or being deported. How else may this affect behavior change, the fear that communities are facing? Yes, please.
Their level of trust, it's hard to get trust from them, I guess. So if they do see healthcare providers, they're already kind of afraid to really be honest with them, which will end up we won't be able to help them.
Mm-hmm. So level of trust. Thank you. Anything else? Yes, please.
This could lead to social isolation, which could have other mental health impacts.
Mm-hmm. Social isolation. Great. Anyone else? Yes.
They're afraid to report crimes against them.
They're afraid to report crimes against them. Mm-hmm. Thank you.
Sometimes oppression becomes so deep that people start to commit lateral oppression.
Lateral oppression. Can you explain that for me, please?
Substance abuse, domestic violence in the families. I see that a lot in my community as indigenous people, historical trauma and the impacts of historical trauma that are continuing even today. Mm-hmm. And that's happening now with my brothers and sisters on the southern border of Turtle Island, where they're taking their children away from them. That's not nothing new to this country. Mm-hmm. They bought and sold African children. They took indigenous children, and now they're doing that now. Lateral oppression causes lateral oppression. Mm-hmm. We become internalized and we start to hurt one another.
Mm-hmm. Thank you for sharing. If you're afraid to access services, are you likely to go to your job, to drop your kids off at school, to continue to access the community services that you know keeps your family healthy, right? Are you going to do that, or is the fear going to overcome all of those healthy behaviors, those things that we know that keep people healthy? Those are the types of upstream factors that we're talking about, right? So if I could go back for a moment. those are the types of living conditions that people are accessing or not accessing because of fear, including the health environment, the health services environment, the home, the workplace, all of those places too. So thank you for sharing. So 1 year later, we followed up that study, and that was after the Trump administration had released, after much of after releasing the executive order, excuse me. So what we found when we studied interviewed a year later of behavioral health directors was that this acute fear was getting worse. That ICE and the fear of ICE leading people to further isolate themselves, right? And people were not going to treatment for their mental health services. Some places, however, were experiencing an upsurge of services, so their providers were facing more vicarious trauma, right? By more people coming in. And there was an overall climate of uncertainty and misinformation. So I don't want to steal any of Miley's thunder. She's quite amazing, and she'll be here next week with me. But we did move into action after we did these two studies within our public health departments. And what that looks like is putting out welcoming messages, creating sanctuary health systems, doing know your rights and material distribution, as well as a few other of these things. So now I'd like to move us into climate change and how that impacts our immigrant communities and their mental health. So the findings from our two briefs on, we have a built environment committee who helped put this paper together on resilience. And then we had a North Bay resilience fire brief where we interviewed our counties in the North Bay after the fires. And the main finding I have for this slide are the effects of climate change are happening right now with fires, extreme heat days, and severe weather. And these, again, are most acute within our disaster recovery response teams. So when we think about resilience in terms of policies and planning, this is important for us to consider. So climate change now is exacerbating our health inequities. This is happening through our climate change impacts, such as the extreme heat days, severe weather and drought, and leading to health impacts such as increased frequency of heat events, leading to heat stroke, heat exhaustion, kidney stones, aggravation of cardiovascular and respiratory disease, are some of the health impacts. And the groups most impacted are older adults and children, our farm and outdoor workers, and those with chronic health conditions, and people living in low-income urban residents. So I'd like to zoom in on heat for a moment to talk about that. A heat wave is a prolonged period of excessive heat. So this is many days of heat where your house doesn't get a chance to cool down. It just keeps heating up and heating up. This we know can lead to heat stroke and death, right? In July through August of 2016, there was a 10-day heat wave here in California. There was over 655 deaths and over 16,000 hospitalization admissions. So this is the type of climate change impacts that are affecting our health today. One of our member departments, Contra Costa, released a climate change vulnerability study focused on heat. And what they found was a spike in number of ER visits for that long period of time in 2006 for those heat days. So it's not about how hot you're used to it being, but it's how hot it will be over periods of time, right? So from this research, we found we need to know what recovery really looks like for health equity populations, those that we're most thinking about, such as older adults, children, people with chronic health conditions, or immigrant communities. And long-term funding is needed to support this, to support what this looks like in this process. So how did our immigrant communities in North Bay experience the fire? They faced significant barriers in seeking aid. They didn't want to attract negative attention from authorities, and they were hesitant to provide personal information. So are you starting to see the theme of fear and what that and how that impacts people's health, right? How tangible this is. I'd like to read a quote from one of our public health departments, one of the staff members of the local assistance center in the North Bay. At the college, we were asked to walk through the parking lot because people weren't coming inside. They were just staying in the parking lots in their cars because they didn't want to go inside and because there was a rumor that ICE was there. So we started posting signs saying everyone is welcome, but that fear was there if they were going to ask us for the information. People wouldn't want to give us their names. So here are some of the next steps or actions that you can take to build resilience before the storm of that we know is happening within climate change. Those include supporting strong neighborhoods to build connections and support systems with one another, doing formal check-ins during disasters, finding areas at risk for flooding and addressing those vulnerabilities up front. This is some of that resilience planning that I mentioned earlier, and assisting clients with emergency preparedness. So here are some of the offerings that we have in the form of trainings for this type of work and thinking about systems level change. One is our Interrupting Hate and Bias series training, which includes our bystander and microaggressions and bias in the workplace. And the other is our Adaptive Leadership for Racial Equity series, which goes from 101 to 301. Here are some of the Bar High policy and action advocacies of which you can do. I apologize that it's not, can't really see it very well up here. But one is the California Values Act, SB 54, was a policy, and you can click here and find more information. This was policies developed by the Attorney General's office to help limit the data sharing between ICE and public health facilities. So if you wanted to know, if your public health facilities or health facilities in general wanted to know how the rules and policies as well as what people have done before, you should definitely check that out. I encourage you to. Two, be submitting comments on public charge. And next month I'll be talking more about what public charge is. And just as a one-liner, public charge is a test. Well, let me ask, has anyone heard of public charge before? No? Okay, so next month, I'm very excited to go into that with you. Public charge is a test for anyone applying to come to the U.S. or being a citizen to identify who may be dependent on government as a main source of support. So previously, this has been around for over 100 years, public charge. Previously, there were, it was a small, limited criteria to determine if people were going to depend on the government. And they, since then, since October 10th, they released new changes to the rule, to the public charge test. And that expands what they're looking at now for that. So they're now looking at non-emergency Medicaid, healthcare. They're now looking at enrollment in housing programs, so Section 8 housing, for example, and SNAP, our nutrition programs. So they've started to expand the criteria of how to determine public charge. This has huge impacts, and I encourage you to submit public comments as well as to find out more information. And there's also some template comments for you there. And lastly, to vote on housing and to look into those and at the state props 1, 2, 5, and 10, because as we know, there is a housing crisis, right, in the legislature, and other people have put measures on the ballot, so I encourage you to see what that is about. I think that's, thank you so much for having me. I'm happy to answer any questions and any material.
Are there any questions?
I was wondering if you could talk a little bit more about the sanctuary health systems that you mentioned, what those look like, and how strong are those protections for patients that come in who are undocumented immigrants?
I didn't quite actually hear the first part. The what health systems? I'm sorry.
Sanctuary health
The
systems?
sanctuary health systems. What that looks like?
Yeah, like what kind of protections are in place and how strong are they?
Great question. The sanctuary health systems are those that are in partnership with our public health departments and have come out publicly to say we will continue to provide a safe place and we will continue to provide care for all of our members and all of our residents. And so they've put that publicly out there. They've also put together communication messages and some training to their staff to be able to communicate to their providers. So I don't have the exact details, but I'm happy to follow up and give you more about that. But that's the intent of the sanctuary health systems.
Thank you.
I think one of the things that our students are getting a good grasp of as part of the public health program is understanding the importance of translating this public health information or these public health risks to non-clinical and non-public health entities, and it sounds like that's exactly sort of what Bar High has done, and I know some of the work that Dr. Alberg has done here is being able to translate that to other entities like transportation, obviously housing, and understanding that importance. Can you talk a little bit about who those other entities are within Bar High? I know you talked about some of the political key figures, but who those other entities other than developers that are been involved in the process?
And are you, just a clarifying question, are you specifically talking about the housing work?
Well, it sounds like all of the work that Bar High is doing, it's included collaborations of a multitude of factors and individuals.
So the question was, I'm gonna do my best to wrap this up, to articulate, was public health, a lot of public health work is also partnering with others and translating that to other people who may not have that body of public health knowledge and how to work with them. And so explaining a bit more Bar High's partnerships and that type. Did I get that right? Okay. Well, thank you for the question. No, that was great. Thank you for the question. I appreciate it. Bar High, we have our members are the directors of the public health departments and also the senior level staff of the program. So we have maternal child health directors, we have workforce workforce development folks in the room, accreditation folks in the room, clinicians. Those are the level of people that are thinking about systems change, and who we partner with are who public health partners with. So, for example, in San Mateo County, they have a Get Healthy Health Equity Planning Unit, and this is part of their planning within their health system. And so, the director of that program is also one of our members on our executive committee and helps to connect us to on the ground grassroots organizations and community-based organizations, as well as other health system folks as part of that. The challenge is that public health departments and their partnerships with healthcare entities like hospital systems and clinics, for example, are different, right? So some may be in a county organized system where they all kind of fit underneath one roof. Some are different systems, so it's a little bit tricky, but it depends on the issue. So our housing work is mostly planning folks who are part of that and planning departments in partnering with public health. Our immigration work has been mostly social service agencies. So the Bay Area Social Service Agency Consortium, I believe BASC, is one of our key partners in helping to develop some of our public charge and our immigration work, for example. So it depends based on the issue. Great. Any other questions or thoughts, reactions? I like those too.
Yes, so mine sort of relates to what we just talked about, but I'm wondering also where there may be conflicts and how Bar High handles that. For example, working with police departments in the various counties, working with, if ICE wants to come into a hospital or be in the parking lot, because I have heard of those situations where people are coming out of a hospital and they get picked up, or they're waiting for transportation and they get picked up. So what about that? How does Bar High interact with those situations that involve the delivery of healthcare or public health services that might put people into conflict?
The question was, how does public health and Bar High work with entities they may be in conflict with?
Well, yeah, I think in conflict with in terms of saying that there's sanctuary or that there's safety.
In terms of
there
safety.
isn't always safety.
In terms of safety, specifically related to immigration and
Yes.
Great question. So our public health entities have actually been pretty forward with making their spaces safe and have had support from the Attorney General's office within their model policies and have had a very strong position that they've been able to hold. And have had the policies to limit those interactions with others. On the day-to-day of the ground implementation, if there is a frontline staff working in a hospital or clinic setting, and there's a federal agent that comes in asking for records, right? That takes a lot of being proactive to help train that person to know what to say. And a lot of that is, I think each individual health system figures out once they kind of determine they have the capacity for those trainings and those so the capacity for that. But it's tricky. It's certainly tricky, especially as it relates to police and enforcement. It's definitely a tricky one, but we found that holding health equity as our standard is a really strong place to be and to collaborate with others. Any questions or thoughts, comments, reactions?
I just want to say that I think it's really wonderful for all the Bay Area to have an organization like Bar High and to see the progressive leadership come together and try to have the strength of not even just working county by county, but coming together. So I just really want to applaud your work. I think it's really for all the people in the Bay Area.
Thank you so much. Really appreciate that. Thank you, everyone.
All right, we're going to end a bit early today. I do really appreciate both of our speakers for presenting the mental health impact voice for immigration and just the different aspects that you as our future clinicians and public health practitioners need to be aware of and incorporate into practice. So I hope that you're able to think about what you've heard here. We're going to post the slides from both presenters in addition to additional information, especially for our 632 students who at this point need to start deciding what you're going to write your policy brief on. If you have any other questions, we'll also make sure that we post the contact information for our presenters. Thank you.